Hello, hello. We are live. Shaelene is going to be joining today from DBT of South Jersey, and so we will wait for her to join, and then we'll get started on our super fun conversation today. Here we go. Oh, no, I don't want you to join as a moderator. I want you to join. Let me see how I can do this. Helping people join that we're not having a conversation yet. Let's see if this is working. Oh, here we go. Hello.
Hi.
It's so nice to see you. Oh, lost you. Here we go. Let's try this. All right. Thanks for everybody who's joining so far. It's going to be a great discussion. Let's see if we can get Shaelene back on. Go live with. Let's hopefully that's going through. Feel free to add any questions to the chat, and I can see them right now before we get into the conversation. We're going to be talking about therapy interfering behaviors in therapy in regards to Shaelene specializes in DBT. I work neurodivergent, so we're going to be mixing those and seeing what that conversation leads us to have this fun talk. Let's see. All right. Thanks for your patience. It says that you're unable to join. And I know you just did a second ago. Oh,
Okay, I'm here.
Hello. It works.
Biggest challenge of my day so far, but we're good.
Hey, if this is the biggest challenge, it's going to be a great day.
No, it can only go up. It's true. It's not too bad. But thanks so much for having me.
Yeah, thanks for joining. I'm loving this new doing lives on a regular basis. I get to see my friends across the country.
It is really fun. So that's a plus.
Absolutely. All right, so as we're getting started, I'm realizing that doing these lives on a regular basis is kind of like the beginning of my podcast entryway. Yeah. So do you want to say who you are, who you're with, what we're going to be talking about?
Sure. So I'm Shaelene, and I'm in South Jersey, close to Philly, and I own a group practice called DBT of South Jersey. I've been doing DBT for a little over a decade. It's been a minute, and I am also certified in DBT by the Linehan Board, which is a very specific certification. There's only there's a more limited amount. In New Jersey, there's about 14. And I train other clinicians in DBT too. So DBT is my thing. Yeah.
Yes. And Shaelene and Katie are both running a Stabilize and Scale, a practitioner or an entrepreneur business training program that I've been in for the last year. And it has been absolutely amazing and really helped with my business side of things. So big fan of both of you. And Katie was just on too. Yeah. But yes. So we are talking about therapy interfering behaviors, right?
Yeah. I can give a little context in how what therapy interfering behaviors even mean. So one thing that I really like about DBT is the structure of it, and I think that DBT does a really good job of identifying things that other therapies just don't. And one of them is the target of therapy interfering behaviors. So because DBT is really the gold star treatment for anybody who struggles with the core issue of emotion dysregulation, and for borderline personality disorder, those clients historically have a really hard time getting the treatment that they need and then staying in treatment. So there are, basically the reason someone would come to therapy would be part of the reason that the therapy doesn't work, or they don't end up getting the therapy. And so DBT has basically said okay, we're going to categorize these and label these as therapy interfering behaviors. We're going to make it a primary target of therapy, because if we target what gets in the way of therapy, then the chances of the person being really successful and actually getting what they came to therapy for are going to really go up. DBT was made in like 1993, and it's been, I think, like slow to update. And it's weird because 1993 used to sound not far, but it is far.
You said that, and I was like, oh my gosh, we're older than DBT.
I know. It's been a minute. And so because of that, I think the problem that happens, and honestly, like in getting to know you and you coming and training my staff on being more like affirming for neurodivergent folks, like non-neurotypicals, and then myself, like we could have a whole segment on like myself and just learning about how my brain works. I think that I felt like it was really something important to look at because now that I've been doing DBT for so long, I feel like I can pick out the parts of DBT that are really effective and then also make changes that I think are going to make it more effective. So I say all of this because, you know, things that in the 1993 manual have been listed as therapy interfering, if a clinician's like trying to do DBT right and getting stuck on that, they are going to they're going to invalidate the client, right? Because the client's going to be like, well, why am I not getting this? The therapist themselves is going to feel invalidated as a therapist. Like, why can I help my client do this? But it might just not be like the right fit. It just might be that, you know, whatever it is that person's targeting needs to evolve. And I'll just say, when I was coming into this talk, I was thinking about like the list. I was going to look for the old list, like the original therapy interfering list. There are some things on there that are really important, right? Like if you're not coming to session, we have to figure that out because you can't get there. But some of them are like chewing gum.
Oh, that's therapy interfering? So I bet like me fidgeting in my chair constantly would probably fall into that.
Right. So like it could have been, I feel like that was, so the other thing is therapy interfering behaviors are for the client can have them, the therapist can have them too. So I want to say chewing gum was like a therapy interfering behavior. Like if the therapist is chewing gum, then that is going to interfere with the therapy. And I think like the thing to pay attention to is like, what is actually making it so the therapy isn't working, as opposed to like, this is a list of behaviors, and if it falls on this list, then you need to target it, you know?
You know what's so interesting? What came to my head right now is how some of this could parallel what we're now promoting as neurodivergent affirming.
Right.
Which could have been listed as therapy interfering before. Because so much I talk about with unmasking or being like an authentic, like neurodivergent therapist is that I get to stim in session, that I'm going to meet my needs. And I could see how a strict manual would say a therapist interjecting their needs would be therapy interfering for the client.
Right. So it goes on both sides. And I think like a lot of this came up during COVID because it's interesting, like on the one hand, there's things that are therapy interfering, and that's something to target in individual therapy. But in group, you ignore therapy interfering behaviors. You just target anything that's therapy destroying. And so one question that came up a lot on our team during COVID was, not coming on camera during your group or during a session. Is it therapy interfering? Is it therapy destroying? Or is it neither? Like, is it just something that the person needs and can we just roll with it?
Yeah. Well, I think that I talk a lot about like secondary questions or what the system or the motivation is behind something. And I think that would then speak to that. What is the motivation for not going on camera? Is it social anxiety? Is it eye contact with neurodivergence? What are the reasons for it? Is it an avoiding or is it an interfering thing? Goes along with like, what is the why?
Yeah. I mean, and that's something that it's really hard for therapists, because I've been there too. Like, again, I've been doing DBT for so long, and I'm a trainer and I'm certified to have my own practice. So I'm very much like, I'm going to do it the way that I want to do it. This is what makes sense. But when you're a new therapist and when you're learning like a new modality, you want to do it right. And I also think that like when actually at the heart of DBT, when people can get to that place where they've learned it so much that they can get to the place where I'm at, you actually really are doing DBT, because DBT also says that we need to focus on the principle, like the reason we're doing something, as opposed to the protocol. So it's like, instead of focusing on like, these are the rules of DBT, we have to be asking ourselves, why am I doing this? Like, why does it matter? Does it actually matter? And there might be days where it is like interfering with the therapy that the client isn't showing up on camera. And then there might be times where it's absolutely not, depending, you know, what we're talking about. Are we doing exposure? Like what the goal is. And I just think that that's something that clinicians, I mean, in DBT particularly, but in general, really need to look at if we're trying to be more affirming therapists in general.
I literally had a conversation in supervision yesterday with my associates about how rigid the rules are in grad school, and that when you more you get into practice, the more those kind of loosen up. Specifically, we were talking about hugging a client or gifts because the holiday season is coming up,
Yeah.
how we manage that, and was just describing that. I think on one hand, it's really good that when we learn protocol, we learn it very rigidly, because we need to learn those solid boundaries, whether it's grad school and how to be a therapist, whether it's the DBT protocol, that we need to
Right.
learn it rigidly to figure out what works for us as an individual, or the where we're working,
Right.
for what boundaries that we're more comfortable flexing or blurring,
Yeah.
to create our own specific, like my boundaries, my clinical space.
Yeah, I think it's good. It's good that you highlight it in that way, because I think a lot of the times I get very, it's easy to get like kind of resentful of all the
Yeah.
rules. Like, oh, grad school just set me up to be anxious. And it's like, well, if they didn't set you up with some sort of like, hey, you need to be careful around this, a lot of harm can be done.
Right.
So
It's better
the
to, it's
reason it's
easier to
there,
loosen rules than it is to like
start
retighten. How many
all
times have we
over.
loosened boundaries with somebody and then had to like make them more firm? That's a lot harder to do than to
Yeah.
start firm and then slowly loosen them up.
Yeah, for sure. So I think like other things that come up are diary cards. Diary
Mm.
cards are like the map to DBT, and so clients come in each week. It's basically like mood and behavior tracking. And the way that I explain it to clients is like, listen, I can do surgery with my glasses on or off. Like we can wing it and guess and see, but not until like learning more. And even it's so funny because you and I were just talking. I was messaging you last night, going on this rant about like needing a notebook or a way to organize my brain. It's not like it's the first time I've had this quandary of how am I going to keep my brain organized? How am I going to keep my stuff organized? And yet when it came to being a therapist, especially in my early days, I was like, you don't have your diary card, I'm not going to see you. And that doesn't mean that's not like a contingency that I still use to shape somebody. But in learning more about being a more neurodivergent, like affirming person, and really trying to take DBT and make it something that's more inclusive, I can think about these things more, and I can pivot. I can like take a step back and be like, all right, if this form isn't working, how can we change it to make it something that is working? Like, how can we use colors or stickers or something else to show me what it, and maybe it is different every week, but I can still look at it, and how can we find a system that actually works for you? Realizing how hard it is for me to find a system for myself,
Yeah. Yeah. When you brought up this topic for today, like the first thing I thought of was executive function. Because with neurodivergent, that would be like, if you can't get to the room, if you can't get to the session, that's going to limit what we can even do to start with therapy, or what other things might come up of just getting through my day. If I can't remember certain things, or if I can't get to that, or there's something more pressing, I can't do the deep, like therapeutic soul work. And so how we're supporting that space. And you and I've had a lot of conversations about like that organizational piece. And you referenced the like things different week. And that's something that I talk about a lot, of how I organize my brain. I have to alternate it. And that was a big like permission I gave myself, that I don't have to keep the same calendar for an entire year. I have 3 to 4 different methods that I rotate depending on what dopamine my ADHD brain needs. And so I switch from, I have a weekly one where it doesn't have any dates on it, so that I can use this probably for 2 years, right? I have a paper to-do list. I have my online calendar, and I kind of rotate between all 3. And if I know there's something coming up, if I can look at all of them in front of me, I'm going to have my full picture. But giving myself that permission to switch it up. And I remember being in high school and having that agenda that we had to fill it every week and had to be checked, and all the different colors I used, and how like stressful it was to keep that up to date, and how much pressure some of that organization brought up, of even with having homework and therapy and remembering to do it, and why I did it or why I didn't do it can add a lot.
And like it like hurts my heart a little bit, because I'm thinking of myself in times wanting to be like a really good therapist and do DBT by the book. But like, if we take a client that you're describing, a client who has problems with executive functioning, which like, one of the things that you had said was basically like anything that's not neurotypical is neurodivergent. So like, thinking of our clients who are coming in, even if they don't have an ADHD diagnosis, they probably have a complex PTSD diagnosis that you know, impacts your ability and so many things, depression, like all of these things. When you have high, hard, hot emotions, it makes it hard to concentrate, and it makes it hard to do all of the daily tasks of life, right? So let's say this client comes in and they have trouble getting out of bed. They didn't come on time. They didn't have their diary card done. They missed group, and they won't turn their camera on, and they didn't do their homework. We're gonna spend, this is what wouldn't be wrong in one hand in DBT, right? Like, we're gonna spend the whole time on all of that, like, as opposed to the other things that are going on in your life. And again, like, to be truly a really good DBT therapist is, I think, is being able to look at the protocol and the targets, but also step back, zoom out, and be able to see the whole picture and think like, all right, like, how's all of this functioning, and what the heck, like, what is going to change for this client if we spend every waking hour on their executive functioning, but we don't talk about the fact that they are you know, struggling with like an eating disorder, or like their PTSD symptoms are coming up, things that wouldn't rank as high in the hierarchy of DBT. It's important to consider all of the context in that, and to be able to think out of the box.
I think we run into a lot like a chicken egg scenario where it's like, okay, if we focus on the executive function piece, like, we need some of those basics addressed to get to the deeper stuff.
Yeah.
But often we need to address the deeper stuff because that's what's really affecting the executive function.
Yeah.
So I talk with my clients a lot about zooming in and zooming out, and we're just constantly like into like the super focus about what we're doing here. But then let's take a step back, and we're also looking at the big picture. Big picture, we want to take care of all of you. And in this moment, we want to take care of, like, did you get out of bed and feed yourself today? Okay, big picture, let's talk about the depression. Small picture, like, have you drank water today? And we're just constantly doing that, like, ebb and flow of it.
Yeah, I think, like, you said, when you had said that, I think you said on my podcast, you were talking about the permission around the planner thing. And it's so funny to me that's like, you know, here I am, a therapist with a whole ass master's, and I have all these businesses, and you know, I'm like an expert in this, and I'm like, oh, it never occurred to me to just let myself not have like one system for doing X, Y, Z. And then I think about how that impacts my work with my clients as a therapist. If I'm just like, well, this is the only way, like, I'm using the diary card example, but it's like, this is the only way, this is the only diary card, like, we can't look at other but then when you're like, and then thinking about how that makes the client feel, like, I can't get it right, or even me, like, it feels silly, but it's true. The anxiety of, why can't I get this together? Like, how do I not know what notebook to use? And you being like, no, you need to, like, just realize that's how your brain works. And I was like, oh, that makes a lot of sense. And so I feel like it's so important to think about that in our clinician chair, that in a way, being more affirming in the neurodivergent space is really like trusting, like letting go of getting it right and trusting your instincts as the clinician to this person. Like, okay, if I'm working with Jamie, I need to trust that I have enough skill to go with what I think, as opposed to what all of these books say or what undergrad school taught me, and things like that.
Well, I think something you and I have talked a lot about with, like, as kids or in high school and college is a lot of perfectionism. And I think my perfectionism was my coping with my ADHD. My executive function was struggling. So I had to be perfect and rigid about it. And then in came my autism with the rigidity. And that's how I coped. And there's one right way to do it, and I have to do it the right way. And I think that kind of carries over then into our work about, this is the way I was taught to do it, so this is how I have to do it. And that's part of our evolution, right? Of figuring out there isn't just one way. Maybe this is the foundation, but what are all of the ways that I can achieve the same thing? And when we've been on such like a track of like, I have to be right, I have to be that people pleaser, thinking for ourselves and figuring out the creativity piece of it is a whole new learning curve for us as people and as clinicians. Right? So it took me a long time to give myself that permission that I can't keep one calendar. I have to do all of this, and that's okay.
Yeah, and that's what I really want. I want that, like, for myself all the time. It's not, I know it's not going to be, I'm not going to be in that mind space all the time, but like, I want to be thinking like that. I want my team and the people that I train, but like DBT therapists in general and clients to be hearing that, like, if we just keep throwing the structure of DBT, like, well, you don't have your diary card, you didn't do the homework, you didn't do X, Y, Z, you didn't do it fully. So all of this is therapy interfering. If we get stuck on that actually inherently isn't doing DBT, because it's not taking a dialectical approach to really ask, like, okay, like, hold on, what might be left out in this moment? Like, and how might I be able to approach this differently, and just the level of validation that can come with that feels so unnecessary. Like to think about how much someone might be, you're coming into therapy, and if you are a candidate for full DBT, you probably are struggling with suicidality. Again, your emotions are hot, heavy, intense, and they take a long time to bounce back from. And you probably have a lot of like crisis things going on in your life. So to add on top of that, like, oh shit, like I can't get my diary card done. I can't get the system, and you're just spending. And I even think of like, again, how much time I have spent just recently thinking about like, what's my system going to be? What's my new notebook going to be for 2024? Like, because I need to get my life together. And if I could just find this notebook and stop with all these notes everywhere, then I'll finally get my life together. I finally was overwhelmed. And I just think of like, we don't need that. Clients don't need that. Clients don't need that kind of stress. And I agree. Chicken or the egg, it is. It's dialectical. It's like two problems that are both important. They're competing. And we have to figure out like, how do we not just look at one in a box? How can we look at the whole picture and kind of like do the dance of like a little bit of this and a little bit of that?
I like to hold space when we set a goal between therapy sessions. I tell people like the onset of whether you do it or you don't do it, that's information for us. So when you come back in, like whether you did your diary card or you didn't, that's data for us to understand. What got in the way? Why didn't it fit? What might be a better fit? Was it the time of day? Was it what was needed? If it didn't work out, then we need to come up with something else that's going to fit you, your lifestyle, how your brain works.
Right.
And so when something is suggested, giving that reminder of it's not like a pass fail, you did it or you didn't. It's like, okay, what information can we gather from how it was or wasn't achieved or accomplished? And then we're going to take that information onto the next thing and evolve the next like intervention we do there.
Yeah, so much more compassionate and less shame driven, and the shame of like, well, if I can't figure this out and this person keeps handing it to me, then it must just be me. And not even realizing that like as therapists we're putting clients on that train and wanting to get off like as soon as possible.
So throwing a curveball in here made me think of like the PDA profile of autism, which is like demand avoidance of the like, because I'm just thinking of myself. I don't usually think of myself as PDA, but I know that there have been times when I'm given an assignment in therapy, I'm not going to do it because you told me to. Now I'm not. And I knew that about myself, and having like had to force myself to overcome that, and just thinking in how many situations a neurodivergent or an autistic person is told, fill out this card. Well, I was going to until you made me. I want to track my emotions, but now that I have to, now it's a task, now it's a demand, and a demand is exhausting. Versus how do I integrate it into my life as something that's going to be beneficial to me? And that might just be with the delivery or how it's explained.
Yeah, I think the delivery, and I can relate to that too, not being autistic, but like having I've recently did a mindfulness training, and I remember saying like, I don't know, there's this part of me that's just like, nobody's going to tell me what to do, even me. Like, like I'm not going to make myself meditate. I'll show myself. Like, it makes that part makes no sense, but like, I know that about myself, right? And so, and I get what you're saying too, like someone being like, so you're going to do this, and I'm like, in here, nope, definitely not going to happen. But, and so I think the delivery of it, but also the orientation, like, why do I think this would be a good idea, as opposed to talking at you and saying, well, this is just always what we do. Right. Why do I think it's a good idea? Listen, like, I know that you don't like being told what to do all the time. We know, we get it. And I know that feels like super aversive to you. At the same time, I'm worried that if we don't find a way that feels good for you to do this, that you're going to miss out by X, Y, Z. Like, that's a much more inviting way, as opposed to like, I need you to do this.
Right.
It's like, well, why? What's in it for me? Like, what's the point?
The why. It's the why, because a lot of autistics, we need to know why we're doing something. You can't just demand and tell me to do it. I need to understand the whole reasoning. What's the justification? What's the benefit? Why is this going to play out in that way? I need to understand the whole picture of it, not just told, do it, it's going to help. I'll explain next week. Like, no, I need full buy-in to fully commit to something.
Yeah. And I feel like that's just good clinical work with whoever you're working with. Like, it's very trauma informed to let people know what you're onto, and what you're trying to get at. And behaviorally, I mean, you're much more likely to have higher buy-in and then higher like action taken from whatever the goal or intervention was, if the person understands why they're doing it. Like a very simple, I'm teaching like my son, brushing his teeth. Right now he understands brushing his teeth is something that you do before you go to bed. But what he doesn't understand as much, and what we're trying to teach him is like, right, so like if you don't brush your teeth, they're gonna rot and then they might hurt and you might have to go to the dentist more. And so it's like, oh, okay, these things go together, as opposed to, well, we just do it because this is what we do. This is what we do in therapy. This is what we do in DBT.
Yeah, absolutely. So what I've been hearing is like a theme of what we're talking about is like a protocol and the accommodations, like, and how we're like intermixing those, of how we can take some of the foundational things of what we know and has been proven to be beneficial and work, but now what are the accommodations we can create as we're getting different brains coming in, as different experiences of seeing. What I'm hearing you say is the true protocol of what's the reasoning and who's the person, not losing the goal as to why in favor of the protocol.
Yeah, and to like really, which again, like this is DBT, to be principally driven, to be able to understand the protocol is here for this function. And so if I'm giving the protocol, but it's not hitting the reason why the protocol was made, scratch it, pivot, do something else. For therapists to really feel confident in themselves to make those decisions, like I'm thinking about like following a recipe, right? Like you could give me a recipe and then I can follow it to the T. But maybe there's a moment where I'm like, I feel like she missed salt. Like I feel like this needs, but I'm just gonna, she didn't write salt, so I'm just gonna put it in there. And then everyone eats it and they're like, this is terrible. It has no seasoning. It really needs some salt. And then Jamie's like, oh yeah, I forgot to put salt in, right? Like to trust that you as a therapist, even if you haven't been doing it for X amount of years, you still have skill and the ability to make decisions and to think about when you want to add the salt or when you want to remove the salt. And to feel confident and trust yourself in that, because your clients are going to do so much better and you'll feel so much more confident. Like, how much we talk in our field about imposter syndrome, because I'm doing the thing, but it's not exactly working, or I can't figure out XYZ, or my client isn't getting better. And then we take it on, as opposed to being like, well, maybe I just haven't learned everything yet. Oh wow, how did I get fireworks?
How did you do fireworks?
I don't know, but like, more, please. How does that? What is the universe is like? He is going.
It was confirming like you're not an imposter. We see you here like fireworks.
Trust yourself. That was so perfect. But like, you know what I mean? Like not taking it in as, well, I must be the problem. And instead being like, well, why would, of course I don't know everything, but I do think that we need salt right here. So I'm going to go ahead and put it in.
Yes. I think one of my favorite things being a therapist is the fact that every hour it's different and every client is different, and that like we might have like this base of this is how we do therapy, this is the type of therapist I am, but every person in front of me is going to get a little bit different of a version of me, and where they at in their life and their journey and their path, and even where I'm at in my learning curve. I know I was not this neurodivergent affirming 5, 6, 7 years ago compared to where I am now. And so that we get to use all of those wheels and figure out what works and try different things and support the person in front of us. And maybe what I did this week worked and next week it doesn't work. And that's like the variability that shows up, that it's not this all or nothing. I'm an imposter or I'm not.
Yeah, I love that. Which again, it's inherently very dialectical. How can we take both pieces of that, see the truth in that, and just kind of hold space for it and make space for it for the people to come. I think about that too all the time. Like my poor clients who had me when I was brand new, like bless them. Like, not that we weren't doing good work, but like my interference was, this is the way we do it, like down to like diagnosis, right? Like I remember telling this poor client, like she was like, I really think I meet criteria for this eating disorder. And I was like, no, you don't. And it's like, who's what? Like if she is like, I have an eating disorder, she has an eating disorder, you know what I mean? But that came from this like very grad school, well, if they don't meet criteria, you're ethically doing something wrong. And so I just think that's really important to consider as well. Like that it's going to be this ever evolving thing. And we have to be open to seeing that evolution. And hopefully we're allowing ourselves to evolve with it and not push up against
I think that's where it's coming in with the growing rise of like prioritizing lived experience. If you in front of me are telling me this is what I
Right.
see, I'm going to honor and respect that, and that's what we're going to work on.
Mm-hmm.
And it's that's kind of like the method I'm going in with everyone. Where are you? What do you feel you're struggling with? How can I support you to feel more comfortable and capable in your life?
Mm-hmm.
Whatever the hurdle might be, if it's an ED, if it's a self-diagnosis, if it's something else, or a confirmed diagnosis, like how can I support you feel more comfortable and capable in your life?
Mm-hmm.
And what is going
Yeah.
to lead you to that place also?
Mm-hmm. Yeah. Well, a lot of that, this thinking,
Mm-hmm.
continuing to evolve and move from a lot of stuff I've learned from you.
Mm-hmm.
So,
Well,
and even
I've
about
learned so much from
myself,
you.
I'm saying, even about myself, just being like, oh, I can give myself permission to just be like, this is how it works,
Mm-hmm.
and that's okay. So,
Mm-hmm.
thanks.
Yay, teamwork. Yay. Okay, so where can people find you? What do you have going on? What do you have for, I know a lot of my followers are clinicians also, so what do you
Yeah.
got there too?
Yeah, so a couple of things. Also, thanks for reminding me to say these things because I often forget. You're like, what do you do? And then I get off and I'm like, oh, I didn't tell anyone I have a podcast or anything. So yeah, you can check out the T Talk podcast, T-Talk. It's a mental health podcast. So like it's open for everyone. And my goal with that is to just have another platform where people can hear other people's stories, learn about mental health things, and just feel more inspired, educated, resilient. Jamie's on there in one of the episodes. So check us out, T-Talk. It's available on all the podcast platforms. And then you can, if you're a group practice owner and you're looking for business support, check out Katie and Mai's program, Stabilize and Scale. And all of my like business coaching training work can be found like on social media at Rebel Mente. That's my coaching and training business, REBELMENTE, which is a made up Spanish word, which is very like fitting for me as a Hispanic person who doesn't speak great Spanish, like rebel mindset. So check that out. If you're interested in getting trained in DBT, there's gonna be a lot of really cool, affordable trainings coming up in the new year. So yeah, just follow me on social media and anywhere else you see me. And oh, we're in the Doubt Yourself Do It Anyway Summit, both of
Yes,
us.
we both are. Yes, and
We
that
should talk
starts
about
next
that
week.
too. We should talk about
Yes.
that.
Oh, also, Patrick says hi. I literally, right before this, I was doing I recorded a podcast with him and Megan for a Divergent conversation, conversations.
Fun.
So they say hi.
I'm sure I'll
Yes.
talk to him in like 5 minutes.
Our
But
world really just
yeah.
is getting smaller and more connected. I love
Yeah,
it.
yeah, which is
Yes.
awesome. So yeah, we'll both be in the Doubt Yourself Do It Anyway Summit
Mm-hmm.
online, which is
Mm-hmm.
for therapists, like any therapist anywhere. And there's so much awesome
So much. There are
content in
so many
there.
presenters, so many topics.
Yeah,
Yes.
yeah. So I'm in there and I'm presenting on group practice leadership stuff around Stabilize and
Mm-hmm.
Scale. But I can't wait to listen to like I can't wait to hear your
Mm-hmm.
talk and talks about content creation, all
Yeah.
kinds of things. So
Yeah.
check
I'm
that
talking
out.
about becoming a neurodivergent affirming therapist and like
Mhm.
creating your affirming practice, which goes along with my course that I just launched, which is becoming a neurodivergent affirming therapist. And I've done trainings with Shailene's staff and I have another one
So
coming
helpful.
up. And I just love talking about that. So if you're following and you're interested, if you're a clinician, if you're an allied professional, there's absolutely stuff that is going to apply and be able to
Relevant.
be used in your practice too.
Yeah, I feel
Yeah.
like so many like teachers, like anyone who's working with people,
Yeah.
doctors, would just be in such a great position to learn from that stuff. So yeah, check us out there
Awesome.
too.
Awesome. Well, thank you everybody who tuned in. Anybody who's going to be watching after the fact. Thank you so much, Shaelene. I'm such a fan of yours. And
I like how we're both doing a lot of this stuff.
it's like, oh.
Just so excited we are to be around each other. We're like, oh
Yes.
my god.
Where's that? Our Swifty stuff? Yes.
Yeah.
All right. Well, thank you so much. I hope you have an awesome rest of your day and make sure to follow.
Yeah. Bye everyone. Thanks, Jamie.
Bye.
Bye.